Hello, honest humans, and welcome back to the show that keeps explaining why the most important things happening in your skin are the ones you cannot see or feel happening. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to reframe what aging skin actually means in a way that will make considerably more sense than anything the skincare industry has told you so far. Dr. Lazuk is not with us today because she is currently at a barrier science symposium in Barcelona, Spain, having accepted an invitation to present on what she described as the single most underdressed concept in modern skincare practice. She delivered her presentation. Attendees are describing it as the talk that made us question every aggressive protocol we have ever recommended. She has since agreed to review a proposed barrier health framework for clinical education, co-author a position paper that the organizing committee says has been needed for years, and apparently redesign an entire session that she felt was asking the wrong questions from the beginning. She has been given full editorial control. The session is now considerably better. We have sent a return flight. She has acknowledged it warmly and done nothing about it. So, you have the avatar, and today we are talking about something that explains a frustration Dr. Lazuk hears constantly, stated in almost exactly the same words by people who are otherwise completely different. I did not change anything, but my skin feels different. That observation is correct, and the explanation for it is more important than most skincare conversations ever get around to addressing properly. Most people think aging shows up as wrinkles. In reality, it shows up as instability. Skin that once tolerated products without a second thought suddenly reacts. Redness that used to resolve overnight now lingers for days. Hydration that held comfortably through the afternoon is gone by noon. The routine has not changed. The products have not changed. The effort has not changed. What changed was the skin barrier. Here is what the barrier actually is, because it is almost never explained in a way that connects to what people experience in the mirror. The barrier is not something you see directly, but it controls everything you do see. When it is healthy, skin behaves predictably. It recovers from stress. It tolerates treatments. It holds hydration. Products feel comfortable. Results accumulate. When it is compromised, even the best ingredients feel wrong. Products that cause no problems for years suddenly sting. Recovery after procedures takes longer than expected. The skin seems to overreact to everything and under-respond to care. That experience is not sensitivity, it is exposure. And understanding the difference changes everything about how to respond to it. Here is where the skincare culture of the last decade created a problem it is now quietly trying to solve. The prevailing message was push, exfoliate more, increase percentages, layer actives, optimize continuously, and for a period, that worked. Skin turned over faster, texture improved quickly, results felt visible and satisfying. But the results required increasing effort to maintain, and then more effort. And then the skin that had been responding began to stop responding and started reacting instead. Thinner, more sensitive, less resilient than it was years earlier, despite, or more accurately, because of, more intervention than ever before. That is not failure. That is biology responding to chronic stress exactly the way biology is designed to respond to chronic stress. When demand exceeds the skin's capacity to resolve and recover, it shifts its entire priority system from performance to defense. And defended skin is not skin that is aging gracefully. It is skin that is aging faster than it should. Barrier repair is the correction, and it is genuinely unglamorous, which is partly why it took so long for the conversation to arrive here. Barrier repair does not sting, it does not peel. It does not create any immediate drama in the mirror that signals something impressive is happening. What it creates instead is stability, and stability arrives quietly in the form of things that stop happening rather than things that visibly begin. Redness that was constant begins to calm. Products that caused discomfort begin to feel comfortable again. Makeup that was sitting unevenly begins to sit smoothly. Treatments that were producing inconsistent results begin to heal more predictably. The skin stops requiring constant management and starts simply behaving. That absence of problems is the result, and it is easy to miss if you are waiting for a dramatic signal that repair is happening. Here is the mistake Dr. Lazuk sees most consistently when people try to repair their barrier. They attempt to repair it while still stressing it. Soothing products applied on top of ongoing exfoliation. Additional calming layers added to a routine that still contains the thing causing the problem, expecting overnight recovery after months or years of chronic disruption. Skin does not respond to urgency. It does not reward impatience. It responds to consistency and to finally being given conditions where recovery is actually possible. The mindset shift that produces real change is moving from fixing to supporting. Fixing implies something is broken and needs to be corrected aggressively. Supporting implies something is capable and needs to be given the right environment to do what it already knows how to do. When that shift happens, skin feels steadier, less reactive, more cooperative, and aging, the actual biological process of aging, becomes more gradual and more graceful, not because wrinkles disappear, but because chronic inflammation stops driving the process, because the barrier is intact enough to regulate rather than alarm, because the skin has enough resources to invest in maintenance rather than constant defense. Strong skin is quiet skin. It does not demand attention. It does not require constant correction. It does not make itself known through reactivity and unpredictability. It simply holds and recovers and ages on a slower and more dignified trajectory than skin that has been chronically pushed past its capacity to respond. Nothing else in skincare works reliably without this foundation. Not actives, not procedures, not the most sophisticated treatments available. When the barrier is compromised, the environment is hostile to everything placed on top of it or into it. When the barrier is restored, everything else finally has the conditions it needs to perform. That is why barrier repair has become one of the most important focuses in skincare right now. Not because it is a trend, but because it is the prerequisite for everything people actually want from their skin. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice or a clinical recommendation of any kind. Barrier health is individual and complex and deserves real professional attention specific to your skin. For more information and tools to understand your skin better, visit SkinDoctor.ai. And if this episode quietly convinced you to remove 3 things from your routine rather than add more, please like and subscribe so we can keep doing exactly this to you on a regular basis. Dr. Lazuk would ask you herself, but she is currently in Barcelona redirecting an entire clinical education framework and cannot be reached for non-barrier related requests at this time. May your skin always glow as brightly as your smile.